Cox EMS, what's the address, the emergency?
It is 5.
Well, I knew how serious it was. He was dead on the living room floor.
The life of Barry DICKEMANN was nearly cut short when he collapsed in his home in Ozark, Missouri.
He called me and said he wasn't feeling well. And I asked a few more questions, and he said he had chest pain. And I said, let me call an ambulance. And thankfully, our house cleaner, Teresa, was there. And he said, no, Teresa's here with me.
I was actually in the living room, and I was dusting, and we were talking about things, and then he just fell over. And I knew then, that he was having a heart attack.
Barry, age 55 and healthy by most standards, was having a heart attack.
I couldn't get a pulse. At first, I thought I had a faint pulse, and then there was nothing. And I knew as time was going on, that it was not good.
Okay, you do feel him breathing?
Wait a minute. No, I'm not.
Okay. All right, here's what we need to do, okay? Listen carefully. I'm going to tell you how to do chest compressions. Okay.
Teresa performed CPR for approximately 12 minutes.
1, 2, 3, 4. 1, 2, 3, 4. Keep doing it over and over. Don't give up. This will keep him going until the paramedics arrive, okay? 1, 2, 3, 4. 1, 2, 3, 4. 1.
Pretty terrifying, actually. You know that their life is in your hands, and it's just the two of you. You gotta do what you gotta do.
When I coded the first time or had the blockage and fell or was down on the couch, I had no heartbeat. The EMS said that while they were transporting me and shocking me, that they would get a flutter, but they never ever got a good heartbeat from the time I was left Ozark all the way to the hospital here. So during that entire time, technically I was dead during that period of time.
He had no pulse, he had no respirations, his color was changing, he was extremely pale, he was showing no signs of life. And there were times when we would get some signs of life back. However, he would lose it en route and continued throughout transport.
They were doing what they could to bring him back.
Paramedics rushed him to Cox Health in Springfield, where a cath lab was ready and waiting for his arrival.
They got him stabilized and very quickly up to the cath lab, and the stories we've heard of that was that whatever they shoot in there to break up the blood clot, just that they didn't have to chase the blood clot or anything, that it just dissolved. And again, that's when you feel that someone else is at work.
There are multiple cardiac events. The most common would be a heart attack, which is actually an artery that shuts off that does damage to the heart muscle.
Barry was placed in a hypothermic coma to allow his body to heal.
This was to allow his brain time to recover, because they did not know how long he went without oxygen. They don't know how long he went without a lot of vital needs, and this was the best hope we had of having a stronger recovery. He was in the hospital a total of 8 days, from the day he went in to the day he came home, which from my understanding is quite miraculous for what he had gone through.
I was ready to go home, and so they released me and was home for a couple weeks, started back to work, and then started doing my rehab here, and was blessed by the people that helped me to survive, and the nurses here that did just a fantastic job helping me get my strength back and confidence back, because there's obviously emotional issues that you deal with.
They come here and we basically help them come up with an exercise prescription, how much exercise they should do, but it's in a very supervised environment where we have nurses, respiratory therapists, and an exercise specialist that we are monitoring their exercise. We help them look at their risk factors and see what they can modify, like stopping smoking, exercise, losing weight, getting their cholesterol under control, stress management. So those are some of the things that we cover.
Cardiac rehabilitation is a very important aspect of this. It is our transition from hospital care to outpatient activity. And it offers a way to allow the patients to do that safely, to receive the necessary education and instructions that they need. For many years, we've known that patient outcomes are significantly improved if they participate in post-hospital cardiac rehabilitation.
The program here, I was a little apprehensive at first. One, being younger and guy when this happened and thinking I was healthy. At first, I wasn't sure about it. Of course, I was very weak. I mean, it took quite a bit out of me, and so they started the process nice and slow, but they let me do it at my own pace while monitoring me very, very closely.
People that come to rehab after a heart event, we reduce their readmission rate well over 50%, probably closer to 75%.
One of our biggest worries is that a patient will go home and one of two things will happen. They will either just sit in a chair and not get up because they're frightened. They're afraid they're going to break something or they're going to have more problems, and that if they just stay still, maybe they can avoid that. That's very detrimental to their overall health, including their cardiac health. The other problem that arises is they get home and usually due to denial, they want to get back to doing whatever they were doing, and they become too active, doing too vigorous activities too quickly. The best way to get back to full activity is to do it in a gradual fashion where we can monitor some of your body's responses to the activity to make sure you're doing it safely, but get you back to full activity ultimately.
After a heart attack or after an incident, this is absolutely critical. Like I said, not just physically, but also emotionally. Because these ladies and nurses here have done this for years. They've seen a lot of good and bad. And I think they know how to help work you through the situation.
I can't believe it. It's been over a year and it's just still so real, especially to sit here and talk about it.
I'm proud. I'm very proud of Barry and his work. You know, he's a fighter, and I knew that, and I knew he would fight, and I was going to fight as hard as I could for him. It's also a wonderful feeling to know that you made a difference in somebody's life. I think at the end of the day, that's what we all want.
You really appreciate a lot of the simple things, and I don't know, you love a little harder and you fight a little harder, and you feel a little bit more. Everything just comes a little bit stronger because you know it was almost totally turned upside down.